down. Well, good afternoon, everybody, and welcome to what I think is now the 6th webinar of the African Society of Dental and Craniofacial Genetics. And a particularly warm and special welcome to our guest today, or our guest speaker called Petunia Motewana, who's joining us from Cape Town, the University of Cape Town, and her talk is entitled Adapting the Blended Learning Distributed Classroom Model for Training Multiple Learner Groups in Genomic Medicine. She is a training curriculum administrator, training coordinator within the Computational Biology Division at the Faculty of Health Sciences, University of Cape Town. In her role, she provides expertise in training and curriculum coordination, facilitation, and admin support for the division. Notably, Petunia led the coordination of the 2022 and 2023 African Genomic Medicine Training Initiative course, which was generously funded by H3A Bionet. This initiative aimed to cultivate essential competencies in genomic medicine and deliver fundamental genomics and genetics education to healthcare professionals across Africa. She is also an award-winning educator holding a master's degree in education and has now been accepted to pursue a PhD at UCT through the accelerated transformation of the academic program. Her academic pursuits are centered around curriculum development, educational technology, and educational psychology, which reflects her deep-rooted research interests and commitment to advancing the field of education. So now we look forward to, which I have no doubt is going to be an interesting talk. And thank you very much, Petunia. I now hand over to you, and you may take it away.
Thank you so much, Prof. Shetty, for that introduction. Yeah, it's also great to be here. Thanks for the invitation. Thanks to you and your group. So I'm just going to turn off my webcam just so that we have improved connectivity. I hope that's okay. And I also hope you are still able to see my screen. But yeah, so I also just thank again the African Society for Dental and Craniofacial Genetics as well for this amazing opportunity to be in this room, and yeah, and also thanks for the amazing work that you guys are doing, your organization is doing, just to empower dental professionals, also other healthcare professionals. I'm aware you also include other healthcare professionals as well, just to empower them in the field of genetics and genomics research. I think is quite important. So I really do hope that with this presentation, I hope this will add value to your existing work, as I will just outline how we adapted the H3O Bionet blended learning distributed classroom model to train multiple learner groups, in particularly in genomic medicine. Also, I don't know, but I think others are also still joining, but I just thought I thank everybody who has made the time to join this webinar, and also just your interest in learning more about the work that's been done in genomics and genetics field. I also think other AGMT hosting staff and participants will also be in the room. If you're already here, thanks for joining, but I know other people are still joining as well. But without wasting any more time, I'm just going to get started with today's presentation. As Prof. Shetty indicated, I will be talking about how we adapted the blended learning distributed classroom model to train multiple learner groups in genomic medicine. Just to check if you're able to see my slides move. Yeah, are you able to see the outline?
We can. Yes,
Great.
it's moving.
Thanks.
And we can see your slides.
Great, thank you so much, Prof. Yeah, so just for the outline for this presentation, I'll just start off by giving a brief background of the African Genomic Medicine Training Initiative. After that, I'll just talk a bit about the aims and objectives of the initiatives, as well as also the H3O Bionet blended learning distributed classroom model that we used to train healthcare professionals in Africa So this model, we used it for the first 2 iterations, and then we adapted it as well to add additional healthcare professionals, which I will touch on this presentation. So there will be the adapted version of the model that I'll touch on as well. And then after that, I also just touch on the lessons that we learned through the process, which I think is always great to reflect on the lessons learned, because this definitely does help to improve future training. And then we'll touch on the accomplishments as well as the future plans for the initiative, which I think this is quite important, the future plan, especially considering that the H3 Barnett grant that funded the AGFT course has ended the end of June this year, and because of that, we are unable to continue with offering this course, and so it's quite nice to just touch on the future plans as well. Um, so I will start off with a brief background. So the African Genomic Medicine Training Initiative was launched by a group of stakeholders from the H3 Africa Consortium, as well as the African Society of Human Genetics. And this initiative actually started as a response to the lack of genomic medicine training. I'm sure you guys are quite aware that there is definitely a lack of genomic medicine training for healthcare professionals in Africa. So it's quite nice to see initiatives that are able to actually help in reducing that gap. And the course, as I mentioned earlier, this was funded by H3 Barnett, which I actually said it in short as H3 Barnett, but for those who don't know, so H3 Barnett is actually a Pan-African bioinformatics network for H3 Africa. And so the course was sponsored by them. And so the classroom host provided the infrastructure that were used during the course, and the participants or the students attended the course for free. So there was no fee charged for the participants to attend this course, and all the staff were all working on a voluntary basis. So we were not paying any trainers, no classroom hosts were not paid. The facilitators that helped to facilitate the sessions during the course were not paid. The system administrators were also not paid. Everybody was working voluntarily. So you can just even see the motivation to really do help in improving healthcare through genomic medicine is quite nice to see there. And then the aims and objectives of this initiative, just to share some of those aims, were that this initiative aims to develop relevant competences in genomic medicine and to improve genomic medicine education. Also, as well as just to change the knowledge and attitudes and skills of healthcare professionals in Africa. Also, just another aim just to share was that this training also aimed to facilitate the practical application of genomic medicine by the participants in their current roles and the diverse settings using problem-based learning. So what I'm going to do now is to just touch a bit on the model that we used. We will call it the blended learning distributed classroom model. So we use this to train the healthcare professionals in Africa, where for the first 2 iterations of this course, where the first iteration was in 2017 and the second iteration was in 2019, where for this two, we targeted mainly just nurses. So the nurses were the initial target participants for this, and we use the model as you see on the screen. How with this model you see that I hope you can see my cursor here, but these are different classrooms that are in Africa. So these are like classroom sites or local classrooms that are in Africa where they join in their local classrooms. This could either be online or face to face. Wherever they are in Africa, they go to an institution where there's a host, and then they can join in person if it's through institution if it's in person, or the comfort of their home if they're joining that classroom online. And then after that, they would join in a virtual classroom. They all connect from all over Africa. They connect online. We used Zoom for the last 2 iterations to connect with the trainer where they ask any questions they may have. But I will explain this in detail on this next slide here. I hope it's not confusing, but just to talk a bit about how this model worked. With this model, this is even before we added additional healthcare professionals. So this model, this one that you're seeing, it was for the first 2 iteration where it was just targeting nurses. So only nurses very targeted for this model, and then I'll touch later on how we adapted and added additional healthcare professionals and using the same model, but we just kind of adapted it as well. But I'll touch on that later on. So for this one, this model, because I think it gives a foundation of how this model works, is that we would have the participants list. Okay, so first of all, you have a trainer. The trainer sits the comfort of their home or wherever they are. They sit with the content that are on the slide or an outline of the content that they want to teach. This is the indicated content. This is now recorded. So they sit with the slides and they just explain the slides, more like giving a lecture, but this is recorded. So we take the trainer's recording and then we would upload that on we use at UCT, we use Vula as our learning management system. So that is loaded on Vula for the participants to listen to that recording, to listen to that lecture. So the participants could either be face-to-face, like I said earlier, wherever they are in Africa. They would join in the institution in their country to listen to this recording that's on Vula, or they could join in online wherever they are at home to listen to the same recording as well. They access that through Vula, which is our LMS. And then when that's done, so this is like the first half of the day. They're done with that. They've engaged with the recording from the trainer and any other materials that the trainer provided, like readings or so forth. After that, they then move into a classroom. So this is still them. They're either in person or online. And then, okay, I have this cursor here on my way. So they then move in to join the trainer. So the trainer, they still need to meet with the trainer because the trainer will then be able to engage with them via Zoom. We use Zoom, so it could be any video conference platform, but we use Zoom. And then the trainer then engage with them, and the participants get to ask questions to the trainers based on what they listened to earlier in their local classrooms. So if they have any other questions, they get to interact with the. Oh yeah, thanks. The Zoom whiteboard feature is quite nice as well. Thanks for that. But yeah, so that's how this unfolds. That they still get to meet with the trainer on a video conference platform to ask any questions. So that's how the model works. And then now I think I will just touch on how the model was adapted now, the same model I presented on, and how this was adapted to add additional healthcare professionals, just in addition to the nurses. This just shows the flexibility of the model that you can use to train any kind of audience, really. You just need to tailor the curriculum accordingly, of course. So now with this one where we have now extended or adapted the model to add additional healthcare professionals beyond the nurses, is that they follow the same format before they join in a classroom. As you can see, this format I presented earlier on. But then here we just had to make sure that the facilitators will also be able to cater for the additional groups that are added. So when we are sending out a call to call for facilitators, we just had to also vet them just to ensure that they have the experience and the skills to be able to facilitate and engage with this newly added healthcare professionals based on their profession, of course. And then now the interesting part, which is the fun part, which I like, it's when now they have to move in to engage with the trainer. It's now 3 groups now, no longer 1. And how does that work? Is that they get to join in with the trainer, and then first of all, they're all doing the call, which I think is the next slide, but I'll touch on it when I get there, is that they get to all join to one Zoom session, all 3 groups, which is the nurses, the doctors, the pathologists, or the third group here. They all get to join to do the core or foundational modules. They join in one Zoom room, and then they can ask questions to the trainer for that module. And then for the times where now they have to split to join their own specialty tracks or their own their track modules where they have to split, then we make use of breakout rooms where you could have them happen have the course on that day there are sessions taking place parallel. So in the certain breakout room, you have the nurses with their trainer for the nurses. they get engaged with that, and then you have another room for the doctors, and like that, like that. So that's how you can actually do that. But also there's also another way which we also kind of touched on as well that we used, which was also great, was you would also just say, okay, today, this day, we're just gonna do the nurse tracks. So the doctors and pathologists can have a break, like a day off kind of, where you're just focusing on the nurses for that day for the specialty. So you could also do that and say, today we're just doing the nurses track so the others can have a day off. Or you could do parallel sessions depending on what works best for you. But that's how we got to accommodate other healthcare professionals as well. Um, okay, so with this one, it was just showing how a typical day looks like, where this was shared with all the participants and all the staff. It's just outlining that, okay, first of all, you'll be in your own classrooms, and then after that, you join in the main classroom, which is via Zoom, and this is where you get to ask trainers any questions you may have. So this was shared with everybody. Just as an example here, I thought I'd present this as well. So this is what I was talking about earlier on, how you can see that, you can see how with the core modules here, the foundation modules, this is for everybody. They're all on one room, in one room with one trainer for that module, or two trainers for that module. And then they can learn that in the same room. But then here they then split based on their profession to take the modules that are tailored to suit their profession. That's when they join in there. And then I think yeah, so here I just thought I also touch a bit on this slide. So with this slide, this one is really just showing the feedback. So the end of course surveys, I don't know if you'll be able to see this, but it's a bit maybe a bit small, but I just thought I also show this as the end of course surveys that shows positive responses from the participants on just how the collaborative nature of the training was. They found it, how collaborative it was, how beneficial this was to work with different healthcare professionals, to be in the same room with them and learn the core modules with them. How did that benefit them, and how did they find that? And it was quite nice to see this feedback that they actually did appreciate collaborative learning as well, which I think that's something that it is quite important to improve healthcare, because no healthcare professional in a way works in isolation, right? There is this link between various healthcare professionals with a core goal as well. So it was quite nice to see that the participants appreciated that. Now I will just move to the implementation lessons, which I think this is quite important. And so I will just touch on them. I kind of put just 10, but there are many, many lessons. There were many, many challenges. This always is with this kind of courses, especially when there's an online element as well, and especially when you targeting a large group of participants, there will always be challenges, but it's also just a matter of what do you do with these challenges? How are you learning from them? How do you aim to improve with future trainings and activities? So it's quite nice to actually reflect on that. So for us, the first challenge we experienced, well, not really in order, but yeah, just what I'm documenting here, was that we had volunteered facilitators, as I mentioned earlier on, and trainers. And so everybody was working, on a voluntary basis. And we had an issue where some people were not willing to do the work on a voluntary basis. And so for those classrooms that, they were affected by this, and they really were saying, we had a classroom where facilitators were saying, we are not going to do this for free. No. And we actually needed them, so we just had to make provisions to pay them, and we had them on board. So yeah, that's how we kind of dealt with that situation. And then the other issue we had was when participants were registering to attend the course. Although we would make it very, very clear, it would be very explicit, and we would even have the opportunity for them to confirm the email addresses when they are applying to attend the course. We would just always say, please ensure that the email address is correct and that the previous one and the first one, they match, because we will use this to send information that you have been accepted to attend the course. I would make that possible, but make that explicit, but we always had issues with invalid email addresses, and that was definitely a challenge for us, because they kind of in a way dropped out from the course before they could even register to attend the course. and that's a bit sad. And so that's another challenge to just reflect on. But for the case where we were able to, we actually worked with the local classroom staff, because we are the central people. I mean, we hosted the course as the main. Maybe I should have actually touched a bit on that, on how we as UCT, H. Barnett, C Bio, we are the main, the central people that we get trainers together and kind of organize the course, right? But then we are working with the different classrooms that are in different places in Africa, and we have a local host or a classroom host, which often is the PI. That decides, okay, we're going to have a classroom in my country, they're going to come to my university. So the PI does that. So we will then reach out to the PI or the host to just check, do you know anybody with this name? Do you know anyone who may know them? They attended to this course, but the email is not valid. We just use that as a way to see if we can get hold of them. It will work in some cases, but in some cases it will not work. So yeah, that's really something to keep in mind as well if one is thinking of reaching out and having a course like this where you're gonna depend on participants that you've never met and you have no access to, but only through email. um the other challenge was that we had participants that are working on a full-time basis. These are nurses, like I said, we targeted nurses, we targeted medical doctors, pathologists. Most of them have full-time jobs. They were working on a full-time basis. But obviously we had some that were students as well. Others were still training to be medical doctors. They were still studying, but still they were also studying on a full-time basis. So it was also a thing of everybody is busy. So it was really difficult for them to attend the course, 100%. And because of that, we had a high dropout rate. You will actually see the statistics. It's interesting. Yeah, it's really interesting. But I will present that shortly. Um, but we also tried to meet them halfway because we understood that everybody was busy, and it was also just difficult to run the course on a year or month or week or day or time that suits everybody. It was just not possible. And if you do run courses like this, you would agree with me that you can never please anybody, and you just have to agree on a time and date and and month, because otherwise you never run the course because you can't. There's just too many people with different schedules. And so what we did as a way to just meet them halfway was that, okay, we will allow you to watch the lecture recordings or the pre-recorded recordings that the trainer has created for you. You could do this when you can, as long as you will still be able to submit any assessments and any work that you needed to submit on time. We could be flexible like that. So we did that, but we also just made sure that when the other participants that were available, when they joined to ask the questions to the trainer. Now that they're done engaging with the pre-recordings, they will join in live, like I said, on Zoom and ask questions to the trainer. So in those cases where the others maybe were busy or they were not available to join the live Zoom session, we then recorded the Zoom session and then we uploaded that on Zoom on Vula, which is our LMS, our learning management system. And so we just notified everybody that the recording is available, and anybody who was not able to attend the session can then join in to can then listen to the recording as well, and then they can catch up like that. So that's what we did from our end, just to accommodate those that were very busy and had full schedules. Although we actually also made it very clear, even before people could even start the course, when we're sending out the application information, we said very clear that please make sure that you will create time to complete this course, because this course is very demanding, it's very intensive, and there are a lot of requirements. Will you be able to actually keep up? It's a 3 month course, twice a week, about 3 hours for each day. So we made it so clear that whoever is applying, make sure you create time for that. But I don't think people listen to that, or they also just think, oh no, we'll be fine, and then they apply, and then reality kicks in, and then it's a different story. Then people drop out. Um, I'm also just looking at the time, but I also feel like it's nice to share this information. But I see it's 15:26. I think I'm still doing okay with time, Prof.
You are absolutely fine for time, Petunia. You still have a whole half hour left.
Okay, thank you.
Yeah, so no
Um,
need to rush through it.
okay, great, thanks. And then the other issue that we had was language. The language barrier is actually very close to my heart, and you will see why I'm also doing something about this. I will share this now as well. First was that because we are targeting different healthcare professionals in Africa, not in South Africa. I mean, in South Africa, you could say, we could assume you can understand some English, the official language is also English. Maybe you could get away with that in South Africa. But still, I think inclusivity is still important, even if it's in South Africa, because we have different languages still, right? But for Africa, it just also add another element of not everybody in Africa uses English as a medium of instruction. And so people need to understand that. And so what we did for AGMT was that we would communicate with the classroom host to say, okay, please source the facilitators who would understand the participants' language so that they can do the translation when there's a need. So that's what we would do at that time. And then as I think more about this, given that this course is also very admin intensive, it needs so much. I was the coordinator from my end, and you pick up problems, but then you want to do solutions, and the solutions take so much time, and you don't have the time when the course has started. And so this is the solutions that I thought of after the course. Uh, was that other solutions one could work on translating the teaching materials into the various African languages, especially for the African languages that the participants are attending. If you know that you will have participants or you have a classroom that is in Egypt, for example, then yeah, you kind of have to work on maybe translating your training materials into Egypt as well. Or, I'm sorry, Arabic as well. If maybe you have a classroom where they speak French, work on translating the materials into French as well. So that would be a solution as well. And then one could take advantage of the AI tools as well, to translate the materials and to translate the sessions as well, the Zoom live sessions. I know there are some AI tools that can actually help and translate live sessions as well. So what I'm doing just to show that this is actually close to my heart, and I'm currently leading at my with the courses that we have in my division now, I'm leading a portfolio that is actually looking into how we could translate training materials using AI tools for the project that we're working on, and also how these AI tools could help in joining live sessions with us and just help with that translation. I think it's quite great to take advantage of the AI tools now that with AI, just a thing right now, and you can definitely take advantage of the fact that there are so many AI platforms available out there, because I think this is very important to make training more accessible, and inclusivity is key at the end of the day, especially if you want to reach as many people as many people as possible. Accessibility is key. The other challenge we had was the political instabilities. Yeah, I actually got to witness that when I was running a course. I think it was last year, and a war broke out in one of the countries, and most of my participants were from that country. And wow, and it just also was impressive rather to see how participants are going through so much in their countries. There's war, there's instabilities, but they still want to finish the course. That got me a bit emotional, I must say. The dedication, the commitment, the willingness to just finish what we started. And we want this in our bag. We want to have a certificate to show that we have completed this course because it will help us so much. That dedication for me was impressive. It was amazing, I must say. So just to accommodate them and see how we can meet them halfway was, okay, we will, for the countries that was affected by any political instabilities, for those participants, um, we worked on extending the deadline for the assessments for them, for the assignments. And we also allowed them to say, okay, you can send your submissions. If you can't access Bula, you can't access our platform. How else can you access us? At this point, others were sending an email, but they're just saying, only now I have access to my email. I was like, okay, what else will you have next to access to? WhatsApp? Others were like, sure, WhatsApp works for us. Can we submit assignments on WhatsApp? Like, sure. At this point, do that if it works for you. So we had such cases, and we had to be very flexible and very accommodating, and we were in that sense. So yeah, that's that. And then we also had an issue with, this is an obvious one, resources and internet connectivity. This was a big issue for us. Not everybody has access to this, and so what we did, we suggested that the classrooms that were aware, like these are the classrooms in Africa now, in different countries in Africa, those PIs or hosts that were aware that most of their participants or their students will have issues with connectivity, like with connecting to the internet, or that maybe they don't even have a digital device because it's a blended classroom. It has a component of joining in online to meet the trainer. Then we recommended that those hosts or PIs should host a face-to-face classroom, and that in that way it helps with that, because that the PI could use where their affiliation, their university, if they're in a university, for example, then that would be a face-to-face classroom at a university, and the participants or the students will come to the host or the PI's institution and use the devices there, and use the computer lab there and the internet there. So that helped in a sense. And then we also had an issue of yeah, so when we have to set out a selection criteria, for example, the eligibility, not everyone, of course, will accept to attend the course. And so we need to go through a selection process. And this process is very long, it's very lengthy. And we were doing it manually. And so we just suggest that for future training or training activities, it would be nice to consider automation, as this would definitely make the process quite easier. Um, and not as long. And then also we would send out the certificates using AutoCred. We use AutoCred. I think it's a Google um, what is it? Add-on, the Google add-on AutoCred. And so that with AutoCred, we used to send certificates, but it could only generate 100 certificates per day. So we had to like let participants know that, okay, please be patient, especially if you know that you have over 100 people that passed the course. You just have to send an announcement that, yeah, this tool we are using to send certificates can only generate 100 certificates. So if you don't get your certificate today, don't think you failed. Hold on. We are still on the first 100 batch. We will move on accordingly. So we had to just do that. But I think it would be nice to now take advantage of the AI certificate generator, or maybe generate a script or automate the process as well. That was possible. Just also, we had a large number of participants joining in one Zoom Q&A session to meet with the trainer, and we would often have just one trainer or two trainers, but we had a lot of participants joining. We had to get a license to have I think up to 100, no, up to 500 or over 500 participants, because I know at some point Zoom would limit how many participants can join, but we had to buy a license to accommodate large groups per session. We did that, but this is not always desirable because it doesn't offer that, desirable participant to trainer ratio. You kind of want that. But then because of that, you would have participants asking questions, so many questions, because the trainer is there. Now is the opportunity, right? They ask questions, but then it gets to a point where time is up because we can't be in the session the whole day, right? So time is limited. And then how we dealt with that was that we will then take any questions that are outstanding, any unanswered questions, and then we would have that on our LMS on Vula. So we'll post those questions on Vula, and we will just notify the trainer that the questions are available. When you have a moment, please kindly answer them on Vula. If maybe I can go back, as you can see here. Yeah, so if you see the Vula here really does link the trainer with the participants wherever they are. So Vula was kind of really great for us. It works for this model. Just any elements that would allow the trainer to still be able to engage with the participants. So we did that as well. And then the other challenge that we had was I'm just thinking where I was now. I think it was on the last one, yeah, where number 10 was that this kind of model, or just having to run a course, whether online or in person, but if you're targeting a lot of participants, different participants, different healthcare professionals, you have your aims and goals, and you know what you want to achieve. Yeah, so it's very extensive admin work, and the classrooms had to do their part of admin work. The core team, me as the training coordinator, it's a lot of admin work, and because of that, they hired a full-time dedicated coordinator. In this case, it was me for the last two iterations, and for the first iteration, I think it was Dr. Vicky Numbawari, and then for the second iteration was Babalo Chauke. So it needs a full-time dedicated coordinator to oversee the admin work and offer any admin support to local classrooms and so forth. So that is that with the lessons and challenges and how we managed to deal with those. And moving on to the accomplishments and what we managed to, I think we would view this as success stories from the implementation of this model and running the course, was that we saw an increase in the number of participants with each iteration, as you can see. So those are the stats here. So you could see here that we have, for the participants, for the first iteration, only 225 people or participants registered to take the course. And then as you can see, for the second iteration, this increased to 294. And then the third was to 800. And then the fourth was 840 participants registered to attend the course. I think it's also mainly because we added additional healthcare professionals as well. And so there was a huge need for the medical doctors, the pathologists, medical laboratory scientists, and technicians really needed this as well. And you could see that that increased this registration, the number of participants are registered. But obviously, like I said earlier on, there's a huge gap in terms of who passed. It's so huge, and it's interesting. And that's why we would be so happy to, although I did say earlier on that we are unable to continue running this course because the H.A. Barnett grant that funded this course has ended, and we can't continue with running this course and offering this course. But we are very open to supporting anybody who would like to take this on, who would like to. But I will discuss that more when I get to the future courses. The future plans rather. But then it's very important because there's still so many participants that would like to maybe even re-register, and maybe they've worked on their schedules better, and now they're not as busy. They will really do, if they register, they will see the cost through so that they can get to pass. So that's a huge gap there, and that's definitely something to still kind of have this course going because so many people still want this. So that's that. Okay, I'm looking at the time as well because I think I need to create time for questions as well. So let's see. So we also had other healthcare professionals that were not targeted by the course. They ended up participating. As you can see on the screen here, you have bioinformaticians, epidemiologists, biomedical engineers, so microbiologists and so forth. But I'll move on now. We had the opportunity where we offered participants the opportunity to attend sessions that are just focusing on the research projects. And this way we were able to equip them with the genomic medicine research, which I think is quite important. And they had the experience to know how to publish if they need to publish any articles and so forth. And they also had the opportunity to work on research proposal, which I think is quite important to have the skills on working on research proposals. And there are cases where some classrooms also successfully develop their research proposals into research papers as well, which were this publication. I think it was quite nice to see this as well. We also had really positive feedback, which was through the end of course surveys and testimonials. I think it's quite good to know that the initiative has managed to meet its aims and goals as well. It's nice to see that from participants giving that kind of feedback, and participants and staff as well. The other achievement that I think we managed to get as an accomplishment from this initiative was that we worked on also increasing capacity building, where we also invited the AGMT classroom hosts to participate in the in-person, this was an in-person 5-day IBT Train the Trainer course. So this course just helped to equip the host to run the model, the one that I presented on, themselves. If they want to take AGMT and run it in their classrooms, for example, in their countries or in their institution, they can. So we trained them on how to do this. And I think it was quite nice as well. It was well received. We also managed to publish as well. And we are also currently working on some other papers, outstanding papers. We are working on writing this, and we hope this will be published in due course. Okay, the last part here that I'll touch on, and then that'll be it from me, was what are the future plans? As I did mention earlier on that the H.A. Barnett funding has ended, and it's really sad. And so now we need to think of, okay, what still needs to be done? What is the sustainability of the course? yeah, and now the first one here is it would be nice to also just conduct like an impact assessment for this training, especially for the other training, the last two iterations as well, just to have an impact assessment and just know how far this course managed to stretch, especially adding the additional healthcare professionals as well. The other one is we are definitely, this is now more of the sustainability of the course, is that we are considering, okay, we need to implement this model in places where maybe it can run longer, like maybe have the model embedded within universities, like the universities can maybe adopt this and incorporate it in their curriculum so that the medical doctors there or the nurses there can take this as part of their curriculum that they're already taking. So this is one way of going about this. It'll also be beneficial to expand the course and include healthcare professionals who were never targeted by the course before. And hence, we are very happy to support where we can any organizations that would like to expand the course in this regard to add any other healthcare professional groups. Also, we are happy to support institutions that are interested in promoting genomics and initiating genomic medicine training for healthcare professionals in Africa. So, for example, at the moment, currently there is a university in Egypt that they are creating a genomic medicine diploma, and we are already supporting them with this as well. They have reached out to us, and we are already supporting them. They just always just share with us what they need, and where we can, we do step in and help there as well. Lastly, it would be nice to just package the cost with which when it ended the last iteration last year, I used the rest of the year just to work on having everything, make sure that everything is published. For example, we have our training materials already on Viva Hub or Figshare, which is a UCT instance, a public repository where all the materials have been curated and uploaded on Figshare for anybody who would like to just download that zip folder with all the materials and maybe they want to reuse that. So that's a way of just packaging the course because it has the materials there. There are already some guidelines that were used and the templates that were used for running this course or similar courses using the same model within our division that is already published as well. And I'm happy to share that with anybody who may be interested and just spread the word and say, this is there, anyone interested, we have this package, then you may use it with it. Yeah, so I think just to end off, I would like to just acknowledge the SGO Barnett funding. As I did say that the AGMT for all its iterations was funded by SGO Barnett. And I also just like to thank the AGMT working group members for making this possible. This was definitely a group effort. And yeah, I think group teamwork always amazing. And we wouldn't have done this without the working group members. Obviously, also the course organizers and the trainers. By course organizers, we mean anybody who got involved. There were people that got involved in developing the personas, developing the competences and mapping those and just ensuring that we have indicative content. And we worked with the trainers as well, but we also worked with other people that were not even trainers, but they were interested in helping us to just map and have the curriculum final. So just to thank those as well, and the local classroom staff across Africa. We had so many classrooms. I know for the 2023, if I remember, I think for both last two iterations, if I remember, there were over 20 classrooms in Africa that we had. So just to thank those that are within the local classrooms, which are the PIs and the host, the facilitators and system administrators, and the HA Barnett PI and the head of my division, which is Professor Nikki Mulder, also known as Nicola Mulder, and the past training coordinators, I mentioned them earlier as well, Dr. Vicky Mbaware, who coordinated and led the first iteration, and Mr. Babalo Chauke, who coordinated the second iteration, which I think this was in 2019. So that's it for me. Thanks, everybody. Thanks for listening.
Thank you very much, Petunia. I must actually commend you on your dedication and commitment to this course. Despite all the challenges that you might have experienced, you guys still went ahead with it. We have a few minutes. I think we have about 12 or 13 minutes. So if there's any questions, if you could either put them in the chat or you can just unmute and you're welcome to ask Petunia some questions. Or you could just...
I have a question.
Go ahead.
I have a question. Can you hear me? Yeah.
We can.
So thank you very much. It's a very good progress and update. So I want to know, since you mentioned applicants are also full-time employee, and how much do you think they will focus on this program? Because they are already full-time with something else. So can you tell us the success of this program based on those fully employed? And also, what is probably you mentioned already, what is the criteria for joining this program?
Petunia?
All this time I was talking to myself. I have a tendency of forgetting to unmute. Maybe I shouldn't mute in the first place.
All right,
But
you're
thanks
not the only one.
yeah, but thanks so much for the question. Sorry, I think I didn't get the name. But thank you so much for the question. First to talk about how much do I think they were focused on the program because they were fully employed. Yeah, so actually you could tell that people were dedicated and they wanted to take this course although they were fully employed. But we did, like I said earlier, we did make it clear that if you are fully employed, which most of them were, make sure you create time for this because this is intensive. It needs your all because you want to get a certificate as well. You want to make it worth you taking the time from work when you can to do this. But to just measure on how the success was, we would also, you could we could also create space for those that were busy to like listen into the recordings when they can and also submit assessments, but they should just keep an eye on the deadlines as well. But there were cases where people would write and give strong motivation why they need the deadline. And so we'll just reopen the courses as well. And I mean, we reopen the assessments as well and have them reopen the assessments and have them to submit, extend the deadline rather. So that helped as well. Yeah, but you could tell by also when they submitted their research proposals, it's just amazing when they were telling us that we already have a plan to actually get this research proposal published. And you could see it was a group of people that it's clear that they were working. You could see on the application form, they would indicate what they're doing. And when we had them to introduce, because there was a session where the beginning we have people introduce, they get to know each other. And then as a coordinator, you're also observing and seeing that, okay, this one is also currently working. This one is not looking for a job, but they're currently working. And you just check their steps that this person was fully working and now they did 1 to 3, they're having steps to implement and publish papers. They've been submitting all their assessments. They got a certificate. It was just nice to see that that change as well of, okay, this is the person who was busy, but look at them now. And then to just answer your question of the criteria for joining the program, firstly, we made it clear that this program is for those who do not have any basic genomic medicine training or background. So we really wanted to be fair and not because it's in demand and we can only take so many people for the course or per classroom. We were very clear with the selection criteria that it has to be somebody who does not have any genomic medicine background, has never taken any genomic medicine training, and it's also the people that we are targeting. We prioritize those who we're targeting first before we could have additional healthcare professionals. If a host had space for additional healthcare professional group, they can include them if they have space. But we made sure that the selection criteria is mainly the group that we advertise the course for. And we also just made sure that it's people that, they don't have the background, of course, but it's also people that are not, we didn't target students mainly as well. So we would include students like those that are training to be medical doctors, for example, we would include them if maybe we have space in the classroom, but we also just prioritize the healthcare professionals, those are already practicing as well to benefit from the course. I hope this answers your question.
Ted, are you happy with that? I just want to
Yeah,
know,
thank you.
Petunia.
Thank you. It was very good. Thank you. I appreciate that.
Thank you, Ted.
Yeah.
What informed the decision to target nurses initially? Because I'm just wondering, I mean, and sort of what platform did you use to advertise? because I feel that as dentists, we kind of always seem to be on the periphery of a lot of things, and especially genetics and genomics. And we were just wondering, how could we perhaps upskill in the future or have further access to courses of this nature? And what sort of informed your decision to target nurses initially?
Mm. Yeah, that's a great question. Thanks for that. Thanks for that, Prof. So we understood that, okay, targeting the nurses as the first group of healthcare professionals to be trained would be great, would be very important, because nurses are very important in realizing genomic medicine in Africa, because they are frontline workers in most of healthcare professionals. They are frontline workers in most of the healthcare facilities in Africa. And they also have like access to like in-depth and detailed knowledge of like the patients, of the families, and of the communities as well. And so that was that's what informed us to start with the nurses. And then we thought, okay, we will then add additional and expand the course and target other healthcare professionals, because we had laid the foundation. And I don't know if this answers, Prof, your question.
Yeah, I know that's absolutely fine. Because I know that you also mentioned your funding has run out.
Yeah.
And so what is sort of, I know you sort of said it is quite an expensive course to run. How do you
Mm.
plan on moving forward? How do you think you might be able to sort of perpetuate this knowledge delivery?
Yeah, that's a great question, and that's why we really just want to work. I have people that also just write to me to say we are interested in actually looking for funding for this course because we want it to continue. We would like this 1, 2, 3 information from you. Can you please provide? And then we would do that. So at
Mm,
this point, we can only support external people that want to take this forward, because within the Asia Planet has ended, but there are other projects and so forth and other funding. But mainly in my division, we focus more on data science. We more now of data science, and so there's bioinformatics, and with this course, I think it just only had one module of bioinformatics, and that's it. So we more bioinformatics, data science, and capacity building in that sense for the new grants at least. At least with Asia Budget, we managed to squeeze AGMT, which was really great. So for now, we really can just support others, and I think that's
do you think going forward you might decide to sort of deliver the course at a fee?
wow.
You I, I
Yeah.
I think that you would have a lot of interest. So it
Mm.
just might be something that you will consider. Because I do think that, sometimes people might want to have knowledge, access to this kind of
Mm.
knowledge, and
Yeah.
maybe pay for it, from grants that they might have.
Yeah, but no, my PI Nikki does not like charging people to pay to attend courses. No, she's so against that.
Oh,
So the
okay,
yeah, the yeah, yeah. We
that's
we
all
we
right.
we want to, yeah, because we target people in Africa, and the participants. Not everyone always has the money to pay, and we want to make this accessible, so it has to be free. And
Yes, yes.
from our end, anyone else can take this and decide to charge it. That's fine. They're running it. They're hosting it. It's their baby. That but for us, we don't like charging for courses. Yeah.
Okay, that's noble. Are there any other questions? If anybody is interested in asking Petunia some questions, um,
But
you could either
Prof,
put in the chat. Yes, yes. Go
I
ahead.
think you asked a question about the platform. I didn't note it down. Do you remember you
Oh
were
no, I just
asking?
wondered your platform for dispersing, the advert or information about the course. How did you recruit that many participants?
So great question. We made use of H3 Barnet. H3 Barnet is a huge consortium in Africa, and so we
Yeah.
also use their mailing list, and so everybody within H3 Barnet, H3 Barnet has like over, I don't know, almost 28 or over 28 member nodes in Africa, and so it's huge, and so we advertise through the H3 Barnet mailing list as well. We just use MailChimp for that, and we also advertise in all the H3 Barnet social media platforms. If you check the H3 Barnet social media platforms, there's a lot of people, a lot of following. So we also took advantage of that. The Facebook, especially, and Twitter, it's got so many followings. So that helped a lot as well, and that's how we managed to recruit. And also within UCT as well, because we also accommodated. We had a UCT classroom as well, so we also had advertised within the UCT Faculty of Health Sciences mailing list as well, and also in different um what's this now? Yeah, other universities as well in South Africa would also know, especially for those that are part of the nodes that are of Asia Barnet, they would know about this, and then they will share it to the divisions or the departments in their universities. And so that's how we advertise. Yeah.
Okay, no, that's really impressive because I think the response you got was truly, impressive. And that's the one thing. So you by getting that wonderful response, you recognize that there was the need for it.
Mm.
So I think initially, how did you know that Africa actually needed this so desperately?
Well, if that's a great question. But if you are part of the, when you part of the healthcare group and people talk in conferences, and I think attending conferences and also just knowing what is needed out there through maybe reading as well, as you come across articles and then you see that, okay, people are talking about the need to train healthcare professional in genomic medicine. The genomic medicine field as it is, if you're in health sciences, you will know that it's something that is needed, and the future for it's huge, and so there is a need, there's a demand. Other continents are already kind of doing so well in it, and that's why would also just use some of their competencies and adapt them to see how we can tailor it to suit Africa. So really just going to conferences and just reading what's out there and just seeing that there's a need, and yeah, and then
Yeah, yeah.
right, yeah,
Yeah.
yeah, yeah.
So no, that was actually really great because I mean we all know that all the first world or the northern hemisphere has all these wonderful resources and are able to do all of these amazing research, but that's
Yeah,
applicable to their population. And we all know
yeah,
that when it comes to genetics and genomics, you
yeah,
need research for our populations, which
yeah,
can translate, to better management of our populations. So
yeah,
yes, it's truly an impressive initiative. And hopefully going forward, we might or you might find ways of um, carrying on this
yeah,
course. You
yeah,
will certainly have participation from us as dental
yeah,
fraternity members.
yeah.
And we are at 15:59. So we have one more minute. If there are no more questions, if anybody else maybe has a comment that they would like to say, or
Yeah, I'd like to ask if it's allowed.
yeah, go ahead.
Thank you. Since well, you're saying that there are no funds to run the course again, for someone who's interested in branching into especially bioinformatics, what advice or what platforms can we use in the meantime? And should you get to a time where you have the funds and you're able to run the course, how would we be able to know that information and we don't miss the call?
Yeah.
Thank you.
Thanks. Was that Lerato?
Yeah, it was
Yes,
Lerato.
Lerato.
Thanks, Lerato, for that question. You did mention bioinformatics. So what I did is I posted in the chat box a link to a website, H3 Barnet. Now that website is gonna have all your answers. Um, and also in terms of how do you know if we decide to run this again, that website will update it, and we'll make sure whoever is still visiting that website knows where we are, what we're doing in a way, or what link to follow to see what is running. So that website needs to be updated in a way that for those maybe who want to know what's still happening, where are we now? They can, in a way, click a link and still know what's the latest beyond the funding. Yeah, so that website will help you in the latter.
Okay.
Thank you.
Thank you very much for sharing that link,
I
Petunia.
Thanks.
can I have a short comment on one of the questions I have? On this H3AB BioNet. So this is a grant money, right? Do you have a plan for continuity, or what's, or this stops when the grant is over?
Tess. Thanks, Tess. You mean a plan to continue running this course when the grant is over?
Yeah.
Yeah, so the grant is over, and unfortunately, AGMT is one of the initiatives that will not continue beyond the grant. Like I said earlier, because the new grants that we have now, they focus more on capacity building for bioinformatics and data science, more on that than genomic medicine. And so because of that, at this stage, I am available, we are available to help anybody who wants to take this forward, who wants any information, they want to apply for the grant, for the training, or they want to embed it in their own initiatives, or they want to know where's the information. We have curated and uploaded all the training materials, the slides, the recording, everything that the trainers were giving the participants. It's all publicly available. I can actually see if I can find a link and share that with you. So right now it can only continue if someone decides, okay, we want to take this forward. We will not be able to take it forward, unfortunately, because of the new grants that we have. The nature of the new grants do not have a component of genomic medicine, supporting genomic medicine activities, unfortunately.
So the information is out there then, Petunia.
Yeah, it
And
is. It is.
I mean, like, if somebody decides that they'd like to take it forward
Yeah.
and further the initiative, we could collaborate with you in terms of sharing the content. It's and you would be okay with that, or is there any kind of, technology transfer agreements that we need to put in place, or MOUs to sign, for example?
Yeah, I mean, okay, so first of all, before I forget, I just pasted in the chat box the training materials link. So that's the link to Viva Hub to access the materials that we have curated and uploaded there. So you are able to make use of that. What I can just say is it is important to acknowledge if we are reusing these materials in any way, to just acknowledge that. If you go on the Viva Hub and our website, you will see the license that we use and how you should kind of reference that accordingly. So that's the one thing. But to answer your question is to collaborate, it depends on what kind of collaboration you would like to do with us. But if it really is just a matter of we want to take this forward, we don't know where to get started, can we maybe arrange a meeting where you can just explain to us where to get started? We are happy to do that. Or you could point us to the right directions. Or we are also working on publishing a paper, like I said, and I think this paper will also help, Prof, in terms of it touches on what I discussed today, but it will also just kind of help with the steps that we followed when implementing for the additional groups of healthcare professionals. Also, there is already templates that you can use. This were not just mainly for AGMT per se, but it was from within our division. And it's more like a training guideline. I don't know if I can find it quickly now as well. But it is online as well. It's publicly available. That guides you on really step by step on how to do this kind of, to run this kind of model and train your people. Let me see if I can find it quickly, and then maybe I can share that as well. But I'm available. There is my email address. I think when I shared my screen, it was there. But let me paste it in the chat box as well for anyone who may have missed it. And then I can share more information as well.
You will be sure to hear from us, Petunia. So
Yeah,
thank you very much.
Yeah,
There
thank you
we
so
have
much.
it. Okay.
Yeah.
So we have the recording and we have the the link to the training materials. Okay, so if there isn't anything else, it is now 16:06. Once again, thank you very much, everybody, and particularly thank you to you, Petunia. I think we've learned a lot, and in terms of being able to access information that we require. And if there isn't anything else, you will be sure to be hearing from us. Thank you
Not a
very
problem.
much. Thank you. Bye-bye,
Thank you.
everybody.
Thank you.
Bye.
Bye.